It is the nature of an audit to find wasteful spending, misallocation of funds, or weak returns on investment. Unfortunately, the 2016 audit of the province of Ontario's books found examples of all of these, glaringly so in healthcare and infrastructure spending. Joining us now for what she found this year, here's Bonnie Lysyk. She's the Auditor General of the province of Ontario, and we welcome you back to TVO.
Well, thank you for having me.
We're sort of going to cut this up into 4 or 5 different chunks here as we go through different segments of your report, and let's start with the Ministry of Health stuff that you found. Doctors who overbill. How does the ministry, after your investigation, deal with doctors who bill too much?
I think, in the past, they were more active in looking at erroneous bills, looking at problematic bills. And then in the last few years, that process has subsided. And we recommended that they actually do more in that area, identify bills, actively collect them. They've got to change their processes so that I speak to a pendulum, and the pendulum here is maybe moved a little bit more in favor of the service provider, the physicians, and perhaps not as much in favor of the taxpayer. And we think the ministry needs to do more in this area to make sure that they follow up and collect back monies that the province should be collecting back on.
One of the things we do want to do here today is put a lot of what you've said into context. There's 34,000 doctors in Ontario. Yeah. How many examples of overbilling did you find?
No, and you know what? You raise a really good point. I think what we wanted to see is that they had a good handle on all of that. And they don't at this point because they need to do more. We cited examples that we found during the course of our work. I mean, the cardiologist group was pretty good in meeting with us and explained to us some problems around testing. And we confirmed that I think it's about 3 million in overbillings probably should have been collected back, but the ministry hadn't taken action to do that. So we cite examples to illustrate the point how important it is that they do this. But you're right. I mean, generally, physicians in the province are going to be billing fairly.
And has the Ministry of Health indicated to you that they will be more zealous going forward?
Yeah, the ministry, in all our reports, we've had positive responses that they're going to take the recommendations seriously, go forward, see what changes they can make. When we go back to our 2014 recommendations, we found that about 75% of the recommendations we made in 2014 have been either fully implemented or well in the progress of being implemented. So, I have a lot of respect for the ministries and the broader public sector in actually taking seriously the work we do.
Let me find out whether or not you came to any conclusions about how doctors are paid, because we know they're paid in any number of different ways: fee for service, capitation, family health teams, anyway, there's a whole bunch of acronyms that we could spend the rest of the program talking about. Did you come to any conclusions about what's best for the citizens of the province in terms of how doctors are paid?
Both models, the patient enrollment model and the fee-for-service model, have their pros and cons. When we looked at the patient enrollment model, we basically commented that probably there's some tweaks that could be made because part of the compensation we found is payment for people that don't attend the doctor as well. There was about 1.8 million people that didn't attend their doctors who were getting compensated for having them enrolled. And a number of patients, they can't get in on time to see their doctor, so they go to walk-in clinics, emergencies, other physicians, and we think those things need to be taken into account to sort of adjust the way the money's flowed to make sure that payment is for service delivered. On the fee-for-service side, technology improvements impact the fee schedule. And we just think that, there could be more done to look at the fee schedule to make sure that's taken into account so that the fees that are paid are reasonable given the, amount of work that's done.
What about wait times for service? What did you find on that?
Wait times, we found that in terms of physicians and getting in to see your doctor, over the last number of years it's declined, but people do have family doctors, which is the good side of it. That's improved. So that sort of goes hand in hand with our look at the fee schedule, saying that they need to tweak it so that perhaps people can attend their doctors more regularly. The other side is off hours. Doctors, we found, are working 3.4 to 4 hours a week if they're in these family practices. In a number of cases we saw, they're not really open on the hours that perhaps people need a doctor and they go to emergency instead. So there's some changes that could be done there, and doctors could sort of work with the system to make that happen.
Just to clarify, I think you said 3.5 to 4 hours. I think you meant days per week?
Yeah, I did mean days. I'm sorry about that.
Okay, no, just because the docs will be, they will not be happy.
That is not enough work for a doctor.
Exactly.
That's right. No, they work hard, so.
So just to be sure, because the thing we hear about that this government likes to trumpet the most is, if you're waiting for hips or knees or, cataracts, that's the word I was looking for, or, bypass surgery, that kind of thing. They say the wait times are among the best in the country. And even the Fraser Institute has confirmed that. Mm-hmm. Do you have anything that backs that up as well?
It depends on what you look at. There's some of the surgeries that are needed, the wait times are reasonable. There's some surgeries that take, elective surgeries that take a little longer than what the ministry's target are. So you have to go area by area. I think generally we see that there could be improvements in that area to meet their own targets more fully. One of the areas we looked at is the emergency surgeries compared to elective surgeries. Mm-hmm. We do know elective surgeries are getting, in some cases, higher priority, and the 1 in 10 people that come through the emergency that need emergency surgery treatment perhaps aren't getting treated with surgery as fast as what the hospital thinks they should.
I think you went further than that. I think you said there are people needlessly dying because they are not getting the urgent care they need because there are elective surgeries higher prioritized, and also bed blockers who ought not to be in hospitals and ought to be in long-term care facilities. Is that right?
We cited a couple examples where people entered through the emergency room and they did not get the treatment, the surgery, as fast as what the standards for the hospital say should be done.
Who do you blame for that?
I think it's the fact that there is a conundrum between the timing for surgeries. And I'd say in the cases we cited, that played into it really well. I don't think it's a blame thing as much as saying, here's a system issue, we draw it again to your attention, please take that into account. In terms of the bed blockers, you raise a very good point. At March 31st, 2016, there were about 4,000 people in hospital beds that really didn't need to be there, but they needed, something else. They needed long-term care home to be there. They needed home care. They needed perhaps to be in another institution, and they couldn't be moved anywhere because that's where the block is. So as a result of that, these people that are coming through emergency that require an acute bed or an intensive unit bed are delayed because of that. And we're seeing that. We also looked at the 4 specialty psychiatric hospitals this year, and we see that same thing happening in those hospitals. So there really is that issue of moving people out of the hospitals faster, not because it's, you're just trying to create a bed, but really because they would be better treated outside of the hospital scenario, and mainly there because you can get infection more easily in a hospital. Seniors can fall more easily in a hospital than they can in long-term. So there's things that can be done.
I want to stay with the Ministry of Health, but move to something that has been a conundrum for governments for 15 years, and that is e-health. Mm-hmm. This started under the Mike Harris government, and I'm not sure anybody's got a handle on it, and here we are a decade and a half later, and it's still not done and still not working the way it was supposed to. After how much has been spent on it?
Yeah, we looked at that. Overall, throughout the whole care system, about $8 billion over 14 years.
And why is it not working yet?
There's a number of things. One, obviously big province, a lot of complexities. But we think they should have had an overall budget. They should even now have an overall budget of what it'll take to complete this.
They don't have a budget yet.
They don't have an overall one. Most of the focus has been on projects that eHealth was managing, but it's a system beyond just eHealth, right? So we say they need a budget, they need a strategy, they need some deadlines, they need to report publicly against those deadlines. I think a key thing here is, though, sometimes government's hesitant to prescribe. And what happened here is, in terms of implementing it more smoothly, they weren't prescribing software, hardware requirements. And, people made diverse choices, and that affects the integration of information.
So one system can't talk to another.
That's right. They had to deal with that. Also, there isn't a mandatory requirement for putting patient information in the system. So there's a lot of patient information that's just not being entered. And we think that's where government can kind of step up and perhaps look at that and put some more instruction out there so that at the end of the day, you and I benefit from anybody that we deal with in the healthcare sector keeping track of our patient information for us that we could use eventually as well.
Every time I go to my GP, I ask the same question. Are you hooked up to eHealth yet? And every year she tells me the same thing. No, and it's a joke, and it's a mess, and she has a computer, but it may as well be paper files. There's just no interconnectivity across e-health across the province. Who's in charge of making this work and when?
Yeah. There are pockets of success in this. I'm not going to say there aren't. I mean, there are areas that are working quite well in integrating the system. But having said that, Ministry of Health needs to take the lead and provide more direction. E-health has not had the mandate to be more prescriptive, like I indicated before. So I think together, they need to work together and perhaps put out more instruction to help the healthcare system benefit from that and pull together and put in place EHR records for all of us.
Most people who follow this stuff know who Ed Clark is, a former big bank executive, chair and CEO of the TD Bank, and he's obviously helped the government and Premier Wynne with their attempts to monetize some of the province's assets, and he handed in a review of eHealth to the government last week, which stated the following: "Our investments in digital health have brought us to a point where the ongoing value created significantly exceeds the province's cost to maintain and grow our digital health assets. This is a major milestone. Unfortunately, the agency still carries a reputational burden from past difficulties." How satisfied are you that whatever difficulties eHealth had in the past are sort of under control now?
Yeah. I mean, years back, the office did an audit, and I think the issue with eHealth that was the one that became a discussion point in Ontario was the use of consultants versus staff and the cost of the use of consultants. We didn't see that same issue when we went and looked at it this year. I think our issue goes beyond that in terms of implementing the whole system now. I met with Mr. Clark before his report came out. I don't think what he's got in there is much different from what we're saying, although we think the value is only there when the system is implemented and you and I each have a health record that we can have with us that will make sure that at the end of the day, when we land up in a hospital, they know what drugs to give us, they know what reactions we have to things, they know our history.
Right. Let's move on to the roads and the highways, because this one, you're nodding. Okay, I'll just keep it very open-ended here. What did you discover as it relates to how well our highways are constructed?
Yeah. I mean, we started looking at the construction of highways in Ontario and came across the fact that around 2000, the ministry knew that there were problems with asphalt cracking. They did a lot of work, and around in 2007, they came to the conclusion that there were 2 tests that needed to be implemented to test the quality of the asphalt. Between 2000 and now, those 2 tests together have not been implemented. One has, and the other one, which is really the most important one, hasn't been in place.
Why not?
Because I think part of it is, this is where, again, we say the pendulum is swung a little bit too close, further toward the service providers, which in this case are the asphalt producers, the contractors, and they, successfully convinced the government to wait. The test was retested again a couple years later. It was reaffirmed as being a good test in 2012, and it still hasn't been implemented. And I think the reason is that, there's this discussion, and it's a conundrum sometimes for people that work in the public sector. If we force it on industry, then we're going to look like the bad guy. Having said that, we think that the taxpayer is the one that's paying the additional cost while the highway's cracking and having to be repaired sooner than it needs to. So we think they should be implementing this test. The other thing is there's testing after asphalt is laid, and it's taking a core drill and getting that tested. The control over that sampling is within the contractor's hands. We think the ministry should take charge of that to actually make sure, never mind the upfront test, but after the fact, that the concrete or the asphalt that's laid is the appropriate quality. So that was problematic.
From the school of thought that a picture is worth 1,000 words, we're going to show 2,000 words right here. Sheldon, let's bring this up here. This is, there we go. Okay, so there's one on the left, which, as we can see, looks just tickety-boo. And there's one on the right. Now, that highway on the right is only 6 years old, and it's got premature cracking in it already. The one on the left is 13 years old, and I guess performing the way they're supposed to. They're supposed to last how long?
About 15 years, 15. Generally.
Okay, so the one on the left is doing just fine. Now, one of the things that I think made you scratch your head, and probably has Ontarians doing the same, is that some of the contractors who have built the shoddy roads were re-upped and given new contracts to continue to build shoddy roads. Why would that happen?
Again, we recommended to the ministry, and this is a similar issue we saw in our audit of Metrolinx and the way they handle their contracting, is that people are given a lot of chances. And, we kind of akin it to the fact that if you have somebody renovating your house, your kitchen, and they make a huge mistake, what's the probability you're going to continue using them? So we recommended that they need to track the performance of these contractors and make sure that they've got enough information so that they don't have to keep rewarding them business if they do bad work.
Apropos of that analogy, though, if the guy who's doing your kitchen screws up, you might give him a second chance to get it right, but not a third, fourth, and fifth, right?
Exactly.
Is that what's happening here?
That's right. That's
Third,
what we're
fourth,
seeing.
and fifth chances.
We're seeing that contractors and designers that have done bad work continue to do business.
Why don't they get weeded out? I mean, surely at some point you're bad enough, you've got to be stricken off a list of potential tenders, right?
I agree. I think part of the thing is they feel that they could be sued. The government thinks somebody will sue us for not giving them business. But at some point you have to take a stand, and you have to accumulate the information to be able to support your stand.
Did the ministry, I guess this is Transportation Ministry, did they agree with you that it needs weeding out and they will implement that action?
I do believe that. They responded that they will seriously take into consideration our recommendations. They did on the highway maintenance audit we did. They have been successful in implementing a number of changes there, so we've had assurances that they're going to look at this the same way.
The Transportation Ministry also apparently, your report says, paid contractors about $8.8 million in bonuses. What were those bonuses for?
This is what surprised us. I mean, my staff looked at the invoices. We saw them labeled bonuses. We saw the outline of how they do it. It was for meeting contract to spec. And so, that was, another conundrum. We looked at this and said, well, why, if you require somebody to do work, why would you pay them just for meeting the requirements that you specify in the first place? And so we recommended that they review that bonus practice, and the ministry responded that they will.
Review it or end it?
Well, we recommended they incorporate, it's not a bad thing to pay a bonus if it's embedded in a contract and it doesn't make the contract more than what it should be. And so, I think we recommended they look at the practice and try and improve how bonuses are given. So if somebody meets something on time, perhaps that is enough to warrant, or not on time, but maybe a month sooner, 2 months sooner, you pay them a bonus. I think the quality of asphalt needs to be specified in the contract. So that's why we're saying, how can you pay a bonus for something that is just what you want done?
Just doing the job.
Yeah.
Okay, let's in our remaining moments here, I want to talk a bit about Metrolinx. Metrolinx, of course, that province-wide organization which is supposed to regionally plan transportation in the Greater Toronto and Hamilton area. And here's from your report. Metrolinx continues to award contracts to poorly performing contractors that submit the lowest bids. It does not track contractors' past performance. Metrolinx has had many years to implement a contractor performance management system, but still has not done so. How come?
That was our question. We said this is an important area. Having said that, they have responded to us. They are in the process of implementing a system. We think they need to put it in place to use it right away because there are projects that they've been having problems with. So.
You note that when CN does work for Metrolinx, it marks up the rate it charges for labor by, on average, 138%. Again, why?
That whole area of billing from the railways, I mean, obviously Metrolinx has to partner with them because they own the track that, these types of invoices are coming on, but the railways do. But we think what they need to do is better monitor what's happening on the track on their behalf. They need to check that the bills are reasonable. And in this case, perhaps they can have discussions with the railways to see whether or not they can move a little bit on the percentage. We did sample, some invoices, and we do see the markup on them.
This is your fourth report as Auditor General of Ontario, and I want to get a sense about whether or not over those 4 reports you are seeing any progress in the way the citizens of this province's money is being spent.
Each report that I've been involved in since I came is uniquely different. But I think what, in terms of gauging how receptive the broader public sector and the ministries are to our work, I would look at their response in our follow-up report. So we issued Not only did we issue our audits in one volume, we issued our follow-up reports in another. And we're seeing high pickup rates, reasonably high pickup rates in the implementation of recommendations. So I would say that my staff are making a difference when they go into the field and start talking about things that would prompt change. And I think there is, there is positive response to the majority of our recommendations by the ministries and the broader public sector.
See, this is the key. I want to just, in our last minute here, I want to follow up on this, because I think people understand that the Ontario government's $140 billion a year corporation, or whatever it is, that's pretty close, and that, stuff's going to fall through the cracks and bad stuff's going to happen. But I think they would be irate to find out that once you report on these things, nothing was done about it. So I guess I want to find out, when you report on these things, does stuff get done about it?
I believe so. I believe when we send an intro letter out, we have different examples in the office where when we even start an audit, all of a sudden there's some change. My team starts talking, they get positive response from the ministry staff. There's a lot of good people. I don't want this to impact people's perception of the public sector in Ontario. There's a lot of good, hardworking people out there. We deal with the grassroots people. We go out in sites, we talk to people in the field, and I do think they try and make change. And I think, in terms of the response to the recommendation, there's positive attention given to those. As well, I want to mention the Standing Committee on Public Accounts. They do have a role to play. It's an all-party committee chaired by opposition. They have a role to play in helping us as well have the recommendations we make implemented, because they have hearings. People come in, respond to their questions. They make their own recommendations. I think that whole process is adding value for taxpayers. So, I think we're continuing doing what we do because we do see positive response to it. There's going to be the odd thing that, will be up in the media and it'll be framed as a dispute. I see that as just a normal course of our work. I think we all in our office feel very positive, and our relations with the public sector is good.
How about with the government?
I have meetings with the ministers on the report, and I understand where they're coming from, and I
They don't like
understand
you.
what their role is.
I don't have to tell you that. They don't like you.
Well, you know what? I guess I'd say we're not here as an Office of the Auditor General myself to be liked. We're here to do a good job for all MPPs and for the citizens of the province. So, it's not a like game. I think as long as we work with each other respectfully, and I think that's what I think is appropriate. Differences of opinions will be what they are, but it's the respect for the function that we operate in my office that I think is important to make sure that the public sector continues to improve and continues to successfully change for the better.
That's Bonnie Lysyk, the Auditor General for the Province of Ontario, and as always, we thank you for your visit to TVO tonight.
Well, thank you very much.
Help TVO create a better world through the power of learning. Visit tvo.org and make a tax-deductible donation today.